Are you facing challenges in your health? Then Dr. Suleiman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Suleiman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Suleiman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at Mile 18 Bolifamba, and in Douala, we are located at Entre Pilot. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Suleiman.
We're going to talk about something else. We're going to discuss small about the heart. We're going to discuss a little bit about the heart. The heart is a big concern because usually it goes unrecognized till we get into the complication. Hypertension is very common. Hypertension is very common. And there are people that say, oh, well, I have hypertension, you know, my body is used to it and I can live with it. I don't need to take treatment. Is that correct? Absolutely not. But at the same time, we do not want to use drugs all the times. We do not want to use drugs all the times. In order for us to give any antihypertensive medication, before prescribing any antihypertensive medication, we have to look at the heart. We have to look at the heart. Why? Because there are 2 conditions the heart might have. We may have something called diastolic dysfunction, which means the heart is failing to relax. That's diastolic meaning relaxation. Dysfunction meaning is not functioning. That's what dysfunction means. So diastolic dysfunction meaning the heart is failing to relax. So the heart is failing to relax mean what? The heart is tense all the times. So when the heart is tense all the times, it pumps very well. But the amount of blood that is being pumped out of the heart is very small. Because the heart is tense, the heart is failing to relax. When the heart relaxes well, the amount of blood inside the heart will be good enough to be pumped when the heart pumps out and supply the whole body. But when we have diastolic dysfunction, meaning the heart is failing to relax, the amount of blood, assume this is the heart here, inside my 2 hands there, if the amount of blood when the heart is at diastolic dysfunction, meaning the heart is failing to relax, is smaller than usual. So when I pump, I'm pumping a smaller amount of blood to the body, especially the brain. So when I pump a smaller blood amount to the brain, what will happen? The brain, let's say, is used to get this much blood. Now that my heart developed diastolic dysfunction, which is failing to relax, now I'm supplying half of the amount. So what do you think the patient will feel like? If I have almost half of the blood that's supposed to go to the brain no longer going to the brain, the patient will always complain of dizziness. I walk a distance, I get tired, fatigue all the times, especially when you do an effort. Why is that? Because the amount of blood going to the brain is now less than what it's supposed to B. And the reason for that, the heart is not pumping out enough blood. So before I write any hypertensive medication, we must look at the heart and decide, is this patient heart failing to relax, or this patient heart is overly relaxed? This is two different conditions. And the two different conditions requires two different categories of drugs. We cannot give drugs to a patient with diastolic dysfunction to a patient that have his heart all the way relaxed. Now, when we have the heart all the way relaxed and it cannot contract well, we call that systolic dysfunction. Systolic dysfunction. Both of the scenarios are bad, but the one that has systolic dysfunction may be a bit less severe because the heart is dilated. We can have two-chamber dilated heart, and we can have all the four chamber. You know, the heart has four chamber, two atrium in the top and two ventricles in the bottom, right? So when we have four dilated chamber or four chamber dilating heart, that's a bad condition. This is what we call heart failure, dilated cardiomyopathy. Dilated cardiomyopathy meaning the bad heart, the four chamber are all dilated, and now we need to find medication to bring that heart back, back to normal shape, back to normal shape. There are medications that will help this heart to come back to normal shape. How? The best thing we have to do, and basically the most important thing we have to do, is to put this heart at rest. We relax the heart. What puts a load on the heart is the blood pressure. Blood pressure meaning is like you climbing uphill with a car. So when you climb uphill with a car, this is exactly what the heart has to do. The heart is the car. The heart is the car. The car suffers when it goes uphill. Now, if I can make the road flat, the car will go much smoother and easier. That is exactly the high blood pressure. When you have high blood pressure, the car is very difficult to climb. And when we make it a straight road, the car is very easy to go forward. So that is the difference between adjusting the pressure and leaving the pressure high. So the effect, definitely, when you have high blood pressure, the effect is reflected into the heart. So the heart now has to work harder and harder and harder to meet the demands. Exactly like you're climbing uphill with a car. The car will exhaust and you will have to use a lot of horsepower, and the engine will get bad. If you repeat the process day after day, that is very much the same thing. When we have high blood pressure, the heart will get bad. And when we have high blood pressure and the heart has to work every day, every hour, every second of our life to supply us blood, it is bad because now the heart will adapt by something called hypertrophy. Hypertrophy, meaning the wall of the left ventricle. We have the most important chamber in our heart is the left side, is the left ventricle. This is where the chamber that when it contracts, it pumps out blood. Hypertrophy meaning the thickening of the wall of that left ventricle become more than normal. As a result, the amount of blood inside that chamber becomes less. As a result, the amount pumped out is being less. As a result, you're not getting enough blood to do what you need to do. So that's why you get fatigued so quick, and that's why you get dizzy when you do an effort, and that's why sometimes you even can get syncope. Syncope meaning you lose consciousness and you fall. So this is the outcome, and this is the complication of something or somebody with high blood pressure that is being ignored. So as I said, we need to have the road flat like this, not like this, for the heart to be comfortable, and the heart that can work better and give us more results. What am I saying? I'm saying the following. If we have long-standing hypertension, that is high blood pressure, and that long time has already reflected negatively on the heart, that the walls of the heart now become thick, we need to give medication to relax that wall. And there is medication to relax that wall. We call it beta blockers. There is a specific beta blockers and selective beta blockers, non-specific and specific, or selective and non-selective. Anyhow, this category of drugs has proven to increase survival. We're talking about a patient that we already have decided that he has diastolic dysfunction. The heart is failing to relax. So this category of medication will be then very beneficial to the patient that fix the heart and lower the blood pressure. So we have dual benefits here. We have two things. We have dual benefits. We already decrease the heart rate. We made the heart, accommodate more blood, so the heart is more relaxed. And when the heart is more relaxed, and as a result, it accommodates more blood, so when it ejects blood, it will eject more blood. So now more blood is going to my brain, more blood is going to the rest of my organs. I am no longer feeling tired, fatigue. I no longer have the dizziness, and I'm no longer at the risk of having syncope, which is falling unconscious, syncope. I'm no longer at the risk of having syncope. So this is, I said all this to tell you that one antihypertensive drug, if it works for one patient, is not necessarily going to work for you, because this patient might have a condition that you do not have. Because it is common that, we've seen it all the times. Hey, doc, give me a drug like this. My pressure is good and I feel much better. So what happened? His neighbor, oh, what is the name of the drug? Oh, here it is. That's the name of the drug. He goes and buys it. And then the story spread now. Now the whole community is taking the same drug because Dr. Solomon prescribed it and it's good medication. It works fine. So the whole neighborhood now is taking the same drug. That is wrong, because you don't know what he has. His diagnosis might not be yours. Listen to me carefully. If I give somebody a beta blocker because he has LVH or left ventricular hypertrophy, or in other words, the heart is failing to relax, and it works for him because this is his condition. His heart is failing to relax, and this condition, this drug here, works for him beautifully. What if you have the opposite condition, meaning the heart is dilated? And now I give you this drug and I make the heart more dilated. What's going to happen? That's a disaster. That's a disaster, right? So when I give somebody a drug, you guys don't share it out there. Oh, doctor, give me this drug and it's working fine. My pressure is good. I feel good. You might not have the same condition as your neighbor or your brother or your friend, because they meet in the meeting every Sunday or whatever. And I mean, this is life stories. This is what I've been told from my patients. The doctor gave me this drug, is good, take it. So he thinks he's doing him a great favor. He thinks, he did me a great favor. I don't have to go and I don't have to, lose money, and I don't have to do this and I don't have to do that. Here is the drug ready. Because you have hypertension, it worked for me, it should be working for you. Wrong. You're killing your brother, but you don't know. Because your brother might have a totally different condition that requires the opposite drug. I mean, the opposite effect of another drug, not the same. So when I give somebody some medication, it's not necessarily that it's working for everybody, because different people have different conditions. So when we talk about, bottom line is, when I talk about hypertension, I am talking about, evaluation that has to be done by a professional doctor, an evaluation that has to look at the heart, see what condition the heart has, and an evaluation whereby we can evaluate everything correct. What if the blood pressure coming from a problem in the kidney? We have a condition called CKD, chronic kidney disease. Chronic kidney disease can raise my pressure by a different mechanism we're not going to discuss now because it's a bit complicated and it's all medical terminology. We're not going to get into that now. But if you have a kidney problem, you can have a rise in blood pressure. Right? We can have a rise in blood pressure. So what is the cause for the blood pressure? Is the kidney. Fix the kidney, the pressure goes away. Right? Fix the kidney, the pressure goes away. Now, there are different causes of blood pressure. The most common of which is essential. Essential meaning we don't know what causes it, but it's there. Because the kidney is good, Another cause for the hypertension is probably the thyroid gland. So we do the thyroid is good. We do the kidney is good. We do the adrenal gland is good. I don't see any obvious reason for this guy to have hypertension, so we call it what? Essential, meaning we don't know why, but it's there. Now, we have patients that always maintain high blood pressure, and this is maybe, most likely, is a genetic cause. Now, this is what we call familial hypertension. Then if you check the grandmother, probably has it. If you check the mother, probably had it. The ancestor probably have it. So it runs in the family. Like exactly familial hyperlipidemia, fat, too much fat in the blood. And I don't eat any fat, doc, but the fat in the blood is high. Why is that? Because it runs in the family, genetic causes. So this is things that we should be looking out for. Now, do not take high blood pressure lightly, because high blood pressure can cause a stroke. And you're not immune to stroke. Nobody is immune to stroke. If you have high blood pressure, that's a high risk to blow a capillary in the brain. And when you blow a capillary in the brain, that's hemorrhage. Okay? That's hemorrhage. And that can be very, very deadly. And you could have easily prevented that by a small tablet that you take every morning. So, high blood pressure is not to be taken lightly. Now, high blood pressure has to be confirmed. And not everybody with high blood pressure in one setting, I call them, okay, come, I give you this medication and I do this and I do this. No, it has to be confirmed, because in life we'll go through stress. In life we'll go through stress. And stress creates high blood pressure. So it is advisable then, if I take my blood pressure today, okay, it's high. Then I skip a day, I go tomorrow, it's high. I skip a day, I go the next day, it's high. So I did 3 different occasions and the blood pressure is high. And I know I'm not stressed. There is nothing. It's everyday life, maybe my life is stressful a little bit, but now I have 3 different occasions that the blood pressure is high. Then we need to go for evaluation. Evaluation what? What does evaluation mean? I need to know the cause. Is it because of a bad kidney? Is it because of a bad thyroid? Is it because of a bad adrenal or hormones from the adrenals that is out of whack, out of limit? We need to find out. And if it's none of the above, then it's essential hypertension. Then we have to treat, we have to lower. And before we treat, we have to look at the heart. Very, very important. When we treat hypertension, we have to look at the heart. What is the condition of the heart? Is the heart dilated, or the heart is constricted and thick and fat, like the walls are too thick? We have to find out, because with one medication I can treat, like I said, I can treat both conditions, the hypertension, the high blood pressure, and the condition of the heart. I think that is very informative and very advisable, that you guys out there, if you feel your blood pressure is high, do not take it light. Do not take it light. We're going to talk about the heart also for a few more minutes. So we discussed about the heart. If you have high blood pressure, please do not take it lightly. And please do not take a medication that your friend is taking, because your condition might not be the same as your friend. So that is the second advice. There is something called aspirin, baby aspirin, 81 milligram. Patients above 4 years old, they should take one. That's the recommendation. Take one aspirin every morning. But this is not for everybody. Before I give a drug, I have to see, what if you have thin blood? Thin blood meaning you have a problem with coagulation. Coagulation meaning clotting. What if your blood doesn't clot well? What if you have a problem with bleeding? You have a bleeding disorder. Can I give aspirin? So again, even that small aspirin, not everybody can take. We have to know that you are the right candidate for it. We have to know that you are the right patient for it. So just to give you an example, if you have a clotting problem, we have to think very hard about giving you any aspirin, because aspirin will increase the thing out of the blood, and you'll even have you will bleed more. So bottom line, why I'm giving you all those examples? I'm giving you all those examples to be sure. Don't put nothing in your mouth unless you're 100% sure what you're putting in your mouth and for what, and you've been correctly evaluated. So you avoid things that is not really, unneeded. You can avoid, you can prevent a lot of things by just being careful out there and take the advice. Look at things before you put in your mouth. Evaluate everything correctly before you decide to do one thing or another. Now, Let's talk briefly about stroke in 2 minutes. Why would a patient have a stroke? You know, you absolutely today, you can walk today, you can run today, and tomorrow you cannot move your right side. You cannot move your left side. You can no longer talk. Your mouth is dropping from one side like that. You cannot even speak. What happened? Stroke. Yesterday I was fine. Today I have a stroke. Yes, we see it every day. So what happened? That's somebody who ignored his blood pressure, high blood pressure. So it blew a capillary in the brain. When we have a stroke, we're talking about the brain. We're talking about the brain. That is, you blow a capillary in the right side, you have paralysis in the left side. You blow a capillary in the left side, you have a paralysis in the opposite side. Now, you know, this is the most common area. So if the area happened to be a speech area in the brain, that is the area responsible for talking, and you blow a capillary there, you will not be able to talk. If it happened in the motor area responsible for moving your hand or moving your leg, you will not be able to move your hand, you will not be able to move your leg. What happened? You blow a capillary. Why? Because you ignored high blood pressure. So I'm not saying that wait till you have the problem and then fix it. I'm saying it's very easy and it's very free to walk anywhere. A lot of health centers and clinics offer free hypertension. It doesn't cost you anything. Check your pressure. If you're okay, that's good. I advise everybody for normal and regular checkups, especially the pressure and sugar. Sugar is another disaster that we have to talk about. Maybe in another session, we're talking about diabetes and the complication of diabetes. And you know, even young people today, they get diabetes. Okay, so it's not only old age. No, everybody is at risk. Now, stroke is a disaster. Stroke is a disaster, and believe me, it can happen when you don't even expect it. There is a new treatment for stroke that I've been using it, and it's a very good treatment, and it requires you to be on the treatment for 3 to 9 months. But believe me, those who couldn't move the hand, now they can move the hand. They can move the hand, okay, and they can. It's never like before, but they are much better. Before they cannot move the hand, now they move the hand. So it's an improvement. Thank you very much. This is the end of my time. I thank you all and have a nice weekend. And I will see you next Saturday, 9 o'clock. You've been with Dr. Solomon, Your Health Today. Thank you very much. We'll see you next week, Saturday, 9 o'clock. Be there. Thank you.